Tommy John injuries or ulnar collateral ligament injuries are very common in our practice. They're not common in the general population, but with the increased activity levels in our youth baseball players, as well as the other overhead sports such as softball, volleyball, even javelin, we're seeing more and more Tommy John injuries. The Tommy John ligament is actually the main ligament that keeps the elbow stable as we're in this position. It connects the humerus to the ulna, and when the arm is in a cocked position and throwing, it's where all the force is transmitted. With all the increased activity in youth sports and pitch counts, unfortunately we're seeing more and more Tommy John injuries. We see simple sprains that we treat non-operatively with therapy and rest and then a graduating throwing program. Sometimes we see partial tears, which we treat with the same regimen, but we may add PRP injections to stimulate to heal. We see complete tears more commonly. And with those injuries, if the patient is symptomatic and wants to return to high level of play, we can reconstruct the ligament by using a graft from the forearm and have a high success rate. The patient typically is done on an outpatient setting, returns to a graduating throwing program approximately 14 to 16 weeks. We allow the non-pitchers to return to play at approximately 6 months. A pitcher, although he is pitching before a year, actually takes at least a year to retain the full activity. As you've seen in the major leagues, this is a common injury. We see it commonly in our area because of all the collegiate and high school athletes, and also because of the little leaguers' elbow, and sometimes it can be from not following the pitch count as much as we like. We see it most commonly in our pitchers, but also in our catchers, and it's more important that we keep a close eye on the number of throws these kids are making.